want to talk about, or to summarize, 4 key experiences I have had as a doctor in a rehabilitation center helping folks who have addiction problems. I hope that these 4 experiences will help someone who is trying to make a decision whether to bring their loved one into rehabilitation from addictions, or if it's the person in addiction themselves and they are undecided yet but trying to make up their mind whether to check into a rehabilitation center or not. I hope that these 4 experiences that I have lived, observed as a doctor will help you in making your decision. As always, remember to subscribe to our channel, to like our videos, and share with people who may benefit from this message. So straight into it. The first experience I have had is that I have observed that nobody, and I mean nobody, zero, nobody ever goes into a behavior with an intention of being addicted. Nobody starts taking alcohol or cannabis. Nobody goes shopping. Nobody starts watching pornography or spending time on social media with an intention that they will be addicted to it. Everybody starts with the intention of having a good time, having fun, just being happy with their friends, by themselves. But along the way, things get out of control and they slide into addictions. And so when this happens, it shocks all of them that this happened. How did it happen? This is not what I thought would happen. And some of this shock, some of this process of being shocked happens in your mind subconsciously. And so a conflict starts to emerge inside them where their expectations and the reality are not matching up. And this causes some special or some unique reactions. Some of them go into denial. They're denying that there's a problem because they do not want it to be that way, but it's that way. No, they are conflicted and denying. The way you get news that a loved one has passed on and you just can't believe that they have passed on. You are in denial, in shock. And some of them also go into resistance. You think that if you can resist this idea that something has gone wrong, then it will not go wrong or it will reverse. So when people are telling you like, you've actually become addicted to alcohol, you're addicted to pornography now, you're resistant, you want to tell them no and to cause a ruckus and fight your family and be uncooperative, defiant. It is a coping strategy. It is a way of you reacting to this reality that is uncomfortable because you went in thinking things will be okay, but they have not turned out to be okay. The second observation experience I've had is that when people check into rehabilitation center, they seem to experience a benefit that they did not expect, bargain for. And even with therapists, sometimes if you are not keen to observe, you do not see it, you do not quantify or expect it so that you can tell someone that it is there. And this benefit is a certain kind of peace, peace of mind, peace that is inner peace, which starts slowly but builds progressively as they spend more and more days in the center. I've thought about it, and this is how I've quantified it. I'll describe it this way. As I said, you started off engaging in your recreational activity with no intention of getting addicted, but you did get addicted. And now it dawned on you that, hey, something went wrong. You were in denial, you were in shock, you resisted this. So there was a lot of conflict in your mind. And this conflict, in part, was also fueled by the drug you are taking. So whenever you could be up in denial and resistance, you went to take another drink because you are stressed. And so the drink fueled, it caused a vicious cycle of addiction, denial, resistance, more addiction, more defiance. When you come into rehabilitation center, now we cut you off from those drinks because we will not allow you to drink at the center or watch pornography. So a healing process starts to form slowly but surely, and a peace starts to descend on you. This conflict that was being fueled every day by drink, accusations from family, conflict, more drink, is suddenly stopped and a peace replaces it. So an inner peace starts to descend on these people. And I usually observe patients who came in, some of them resistant, being pushed by their families and swearing, being defiant, even not wanting to cooperate with us as doctors and therapists. Suddenly you see them starting to get more quiet, to get more introspective, to engage, a bit shy, guilty, ashamed a little bit, but we know this and we encourage them quietly. We don't shame them or we don't point it out. So we allow that guilt, that shame to die slowly. And you can see that a peace is descending on these persons and they are starting to be happier, to feel more rested than ever before. A third observation that I have made, an experience I have lived working with my patients, is that rehabilitation from any addiction is not a process that anyone, apart from the person in addiction themselves, can step in and help this person move with it. It's like someone is carrying a load. You can go in and help them. Let me help you carry this bag. Maybe it has two handles. Hold this handle, I hold the other hand, and we walk together. It is not possible in rehabilitation. The person who is in addiction will have to carry that load himself or herself until he or she takes it to its final resting place. So what is the work of the therapist, you may ask? The work of the therapist, as well as the family and well-wishers, friends, is you mainly work as fans. The way fans go to a stadium to watch a game of football or whatever, you clap, you cheer, you applaud when your team is winning, but you can never go into the field and play. It's the players who will do the playing. It's like a coach. They're only on the sidelines giving directions. Play this formula, pass to that person, use this strategy we discussed yesterday. But they're outside the field. They will never go inside the field. The people in the field are the players only. And in rehabilitation, the people in addiction are the players. They have to play and score and win. You cannot do it for them. It's a very interesting observation that I made, and I contrasted it with my previous work, where before I started being in rehabilitation full-time, I was a hospital doctor, so I could treat patients with malaria, I could deliver mothers, I could treat patients with fractures and what have you. And it's interesting because in the hospital proper, the doctors, the nurses, the therapists have a larger role to play. They have a bigger role to play. That even if a patient is uncooperative, you can go in and hold their hand and fix that fracture. If a mother is uncooperative or she's maybe first-time mother, doesn't know what to do and she's in labor ward, you can do things to make that baby be born well. And so you are an active participant. It's like you are carrying this load together with this patient. You are sharing in the actual carrying of the load. This is different in rehabilitation. addiction rehabilitation. The last observation, experience I've had, which I would like to share with you, is that I see that the family, the friends, the social circles around the person who is in addiction, who decide to bring that person into a rehabilitation center, are really altruistic. Altruism is the ability to do good without wanting to be rewarded. And it is conditionless love. I compare these actions by the family, by the friends of the persons who are brought into addiction rehabilitation, with those of a parent, of a young child. You give birth to this little kid and you take care of them through thick and thin. You deny yourself everything, including food and comfort, to just take care of this child until they grow up. And you're not doing that because they are going to reward you, because you're never sure that you'll even be there when they are old enough to get anything to reward you. And some parents, even when you're there, you don't ask for it. I mean, if they give you something as a reward or appreciate you as a parent, that's fine. If they don't, that's okay. You did your work and you are rewarded in posterity, like I said when I made the video that your children are not your friend. And I see the same when people are brought into addiction rehabilitation. Because picture this, most of the people coming into addiction rehabilitation are adults. You may be in your 20s or 30s, you may be in college, in university, but you are basically an adult. And so that means that your family can as well leave you to go down the drain like you've chosen as you went into addiction. Or if you didn't choose it, because some people don't choose it, and I've talked about it, they can actually say that it went that way because you allowed it. And so this means that they have an option to just do nothing. An option they didn't have when you were young, 1 day old, 1 month old. They just had to take care of you. And if they didn't take care of you, the law will be on them. The law all over the world, if you neglect children as a parent or as a caregiver, then you will be arrested, taken to court. These children will be taken from you and taken to a children's home where there are people who are employed to take care of this. But we don't have an adult people's home. If you are an adult, 25 years, 30 years, drinking yourself silly in the street, I mean, nobody is going to come and get you and take you to adult people's home where someone will nurse you. And so, while these people, your family, your friends, the people who care about you, while they had the option to just let you go your way and waste your life, while they had that option, they did not. They could have done it. Nobody would have followed them, like government or someone taking them to court, fining them for neglecting you, but they did not. That is the altruism that I talk about. That is the conditionless love that I talk about. And this is a message that is specifically important for the people in addiction themselves, the patients who come in rehab, because some of them may say, oh, you hate me, oh, you're doing this to punish me, oh, I'll be here just because you want. No. These people are actually full of conditionless love for you, full of altruism in your regard. Otherwise, they had the option to just look the other way and let you waste your life. Those are my 4 observations. I hope they help you make a decision faster and better about checking into a rehabilitation, bringing a loved one into rehabilitation, and helping them to recover from their addiction. See you in another video of Dr. BMS. Remember to subscribe, to like, to share this video with someone who can benefit from the message if it resonates well with you.